Jesus wants us to be helping people, and research helps us figure out if we're actually doing that. The certificate itself is bigger than my portion in it, but the thing that I'm doing in it is really looking at mental health ministry. How can mental health be an area of service for individuals where we can help them, we can serve them, but we can also connect them to the gospel? So the course itself will look at kind of general principles about mental health, sort of what are the underlying factors that are both risks for it and protective factors, so that folks can from that sort of think about what would a program look like at our church, or what is our church already doing that's very good for mental health that we could perhaps bulk up a little bit. So we'll be looking at kind of from the foundation, this idea that there's certain things that a church body can do to help people with their mental health. We'll also take a deep dive into the Resilient program as kind of an example of how that works. What we do is essentially a peer support meeting, meaning there's no therapist, no one is there as a therapist, but we meet together and we follow a format which is unchanging from meeting to meeting, that begins with a Bible verse where we look at something related to addiction, some kind of predecessor to addiction, or some character flaw that might be involved in addiction, and we read a Bible verse about that and we discuss it a little bit. And that discussion essentially functions like a confession. And then through the course itself, they're working with a partner organization and helping that partner organization consider ways that their organization can be serving the community around the topic of mental health as well. This course, I think, would be good for pastors, certainly staff ministers, but also anyone in a church that has a significant role in terms of volunteering their time and is interested in seeing how their church can serve people with mental health needs in order that they can then share the gospel with those people. But also, I think a significant portion of the emphasis that we're looking at would be international. So folks that are serving in an international capacity, or folks who are living outside the U.S. who want to learn some techniques about how they can help mental health in their area. We owe it to the people that we're working with to look at our program and make sure that what we're doing is having a positive benefit. Jesus washed the feet of his disciples, and we need to, when we're providing services to people, we need to also be servants. And servants ask people, how was your meal? Is there anything else I can get you? That's one of the qualities of a servant, is they don't tell other people what they need. They ask them a lot. The Meros Center has helped our board be able to get trained and be able to conduct a good portion of this research.